Hi guys, so we're back again with another ultimate guide, but this time we're addressing Botox and Dysport. So let's dive into everything you need to know before getting Botox or Dysport. Okay, so when it comes to Botox, I feel like there are so many misconceptions about the drug. So Botox is a muscle relaxant, it is a neurotoxin, it works by blocking the neurotransmitters that creates the contraction in a muscle, and with that, it stops you from wrinkling your face. The way it works is that when you frown or you lift your brows really high, it doesn't allow for those wrinkles to come up. If you do have lines at rest, and by at rest, I mean when you're just completely still, those lines will soften up, but they won't completely disappear depending on how deep the line is. So that's one important thing to consider, because I feel like a lot of people come in and they think that, you know, they reached 50 years old and they let their face wrinkle up and that Botox is just going to miraculously help the skin completely be wrinkle free, but that's not the case. Botox acts on the muscle and in turn it does help the skin look less wrinkly, but again, it's not going to completely get rid of the wrinkles that are present at rest. Another thing people don't know about Botox is that it's more than just an anti-wrinkle treatment. Botox is used for cosmetic purpose in the lower face as well, but not only that, it's used for non-cosmetic purposes as well. And actually only 30% of Botox use is cosmetic. The other 70% is for different medical conditions. Okay, so when you get Botox, here are some things to expect. First of all, you're going to be pricked with a little needle, and honestly, the pain is really minimal. I wouldn't even call it pain. It is comparable to plucking your brows. It's not painful at all, and a lot of people are shocked with how little pain they experience when getting Botox, and that's because the needle is a 31 gauge, and 31 gauge is extremely thin needle, and it doesn't really hurt all that much. So Botox does take about 10 days to fully act once it's injected. So you actually won't see a result right after you're injected. Right after you're injected, you're just gonna see a little redness, maybe a raised blood. Again, there's the potential for bruising with Botox. And the potential for bruising is basically anytime a needle goes into the skin, there's potential for bruising, because bruising is just when a needle punctures a blood vessel and blood seeps out. So really, it's kind of inevitable sometimes, but typically with Botox, bruising is super minimal, if any at all. I find that majority of patients don't experience any bruising at all. And typically when we see bruising, it's on the crow's feet, just because the skin around our eyes is very thin and it's easier to puncture those blood vessels. So typically when people have bruising, it's in this area. So again, Botox takes 10 days to fully kick in. Over the days, you will notice it slowly kick in. And sometimes that doesn't happen evenly on both sides. So you maybe start to be wrinkle free on one side, but not the other. Sometimes a brow goes riding up a little bit higher than the other, and that's all normal. So until that 10-day mark, just relax and things may settle on their own. If you feel like one brow is going crazy, that's normal. And then at that 10-day mark, after that, it lasts about 3 to 4 months. And sometimes I get clients that say that they've had Botox in the past and they just don't get that 3-month mark longevity. And typically my number one recommendation is the dosage was probably too low. So the lower you dose the Botox, the less it's going to last. So if you get dosed and you still have a bit of movement, that indicates that your Botox is not going to last as long. And that is sometimes a look people go for, but if you just want to get the best longevity out of it, make sure you use the recommended dosage, and if that wasn't enough, then you can always add more. Okay, so here are our pros. Number one is that it's really fast, it's easy, minimal downtime. You may have some redness, but that goes away really quickly. Most people look like nothing happened within 2 hours or so. And the other thing is that it's every 3 to 4 months, so we got a decent longevity out of that treatment. And the last pro is that people really like the result. The result does look really nice, and people are typically really happy and satisfied with Botox. For my list of cons, number 1 is that it does not get rid of those static lines that are found at rest. It does soften them, but it does not get rid of them completely. And secondly, and most importantly, is that if you do experience any side effect, you will be stuck with that side effect for the next couple of weeks or even months. So once the Botox wears off, everything will be back to normal. There are no long-term effects, but if you experience an eyelid drop or a brow drop, you're kind of stuck with that. And we can give you eye drops, and that helps, but the truth is that it will take at least a few weeks to wear off. And that leads me to my next little bit, which is what not to do after your injections. So you want to keep the area clean. Don't apply any makeup or anything of that sort for the next 4 hours. The other thing not to do for the next 4 hours is to rub or touch the area, because rubbing the area can cause side effects that involve brow drops and eyelid drops. So for example, if you go get a facial or get a massage, put your face in a donut, or even wear a hat that's really tight around the brow area, the Botox can move from one muscle to another and create a brow drop. So to prevent that, just be sure not to rub or touch the area for the next 4 hours, and that's going to keep you safe. Another potential side effect that's actually really easy to fix, but when people experience it, they think that they're stuck with it. So if this happens to you, be sure to go back to your injector. It'll take them just a second to add a little bit more Botox to even things out, but it's the Spock brow. And the Spock brow is basically when your brow rides up way too high. And it happens when you're talking or whatever, and you do a surprise face and the brows just ride up all the way. So if that does happen to you, don't be scared. You're not stuck with it for the next 4 months. Just go back to your injector and they'll just do a little touch up of Botox, and that will help bring that brow down to where it needs to be. So there it was, my complete guide on what to expect from getting Botox. I hope you guys enjoyed. Be sure to watch the previous video on the complete guide to getting filler. And if you have any questions, leave them in the comments, like, subscribe, and I'll see you guys in the next one.